Okay, so let's unpack this. Today we're doing a deep dive on a topic that feels more critical than ever.
Definitely. Mental health.
Yeah, the state of mental health in the U.S. We're
Yeah.
looking at the big priorities, the real tough challenges people are facing,
Yeah.
and what's actually being done,
Yeah.
especially, for young people and in rural areas.
Right.
We've pulled together quite a stack of sources for this, everything from policy goals, from a major advocacy group,
Mm-hmm.
to some really practical, down-to-earth questions about hurdles, plus specific reports on rural mental health, national stats, and an interesting youth initiative.
It's a good mix. Gives different angles.
Exactly. So the mission today is really to cut through all this info and pull out the key knowledge, maybe some surprising facts, the core insights. Think of it like a shortcut to getting really well informed, understanding not just the problems, but also what people are pushing for, the potential solutions being tried out.
Yeah.
And these sources, they really do show both sides, the, let's say, ambitious goals alongside the sort of stubborn realities on the ground. Okay, so let's start with those big picture goals then. We're looking first at a major mental health organization's policy priorities. These are specifically for 2025-26.
Right. And these aren't just, wish lists. These are the key areas where advocates are really focusing their energy, pushing for systemic change, mostly at the federal level.
And they've got, what, 4 main pillars?
Yeah, 4 core pillars for their work. The first one, it's something we're hearing more about, but they're really putting it front and center, promoting the importance of lived experience.
Okay, lived experience. What does that mean in practice here?
Well, what's fascinating is how they're framing it. It's not just about, sharing personal stories. It's elevating this as a crucial form of expertise.
Right.
The sources really emphasize making sure that people who have actually navigated mental health conditions themselves, especially young people, are actively involved, even leading policy development.
Because they have insights you just can't get otherwise.
Exactly. They know the system firsthand. It's vital knowledge.
That makes a lot of sense. So how does that translate into policy asks?
Well, this organization, they're advocating for building this lived experience into concrete things, like how we even measure the quality of mental health services.
Okay.
They're specifically pushing to expand insurance coverage and reimbursement for peer support services.
That's where someone uses their own recovery journey to help others.
Precisely. And also making sure warm lines are widely available.
Warm lines.
Yeah.
Those are the non-crisis support lines staffed by peers, right?
Yeah.
For before things get critical.
You got it. Sort of preventative, peer-based support.
Are there specific laws they're backing?
Yeah, the source mentions they're actively supporting bills like the Peers and Medicare Act and the Peer Support Act, trying to get these services covered by major insurers. Also, the Strengthening Supports for Youth Act. And they're pushing for research funding at NIMH, the National Institute of Mental Health, to specifically study youth peer support.
So it's a clear signal. Lived experience isn't just anecdotal. It's becoming, well, a professional pathway and a legislative priority.
Absolutely.
Okay, so moving to the second priority, advancing prevention and early intervention. This sounds like the classic public health idea, right? Getting upstream.
That's exactly it. It's about investing upstream, trying to address mental health and substance use concerns much earlier, ideally, preventing them from escalating.
And what are the key strategies there?
Well, they're pushing for things like universal screening, so checking everyone, not just those showing obvious signs.
Which makes sense, catching things early.
Right. And significantly boosting mental health literacy education, so people can recognize signs in themselves and others and know what to do, how to respond.
And they connect this to broader life stuff too, don't they?
They do. The source highlights recognizing and addressing the social drivers, things like housing instability, food insecurity, lack of opportunity. These aren't separate from mental well-being.
It's all connected.
Definitely. They advocate for creating more supportive school climates and, this is notable, pushing for accountability for social media platforms.
The social media angle?
Yeah, the source points out they can create these, toxic digital environments that harm mental health, especially for kids and teens.
That feels incredibly relevant right now. Are there specific bills mentioned?
Yeah, the source lists several aimed at youth prevention, things like the Kids Online Safety Act, the Youth Mental Health Research Act, the Early Minds Act. There's even mention of a Stop the Scroll Act, which they expect to be reintroduced.
Wow, quite a few.
And they're also calling for more government funding for programs like the Mental Health Block Grant and CDC centers focused on injury prevention, which includes suicide prevention work.
It really shows that prevention is broad. It's everything from, individual education to tackling big tech.
Huge range.
Okay, priority number 3, increasing access to mental health and substance use care and supports. I mean, this has to be one of the biggest hurdles.
It absolutely is, and it's multi-layered. Insurance coverage is just fundamental. The source specifically calls out concerns around Medicaid unwinding.
Right, that's the process where states are rechecking eligibility after the pandemic ended.
Exactly, and the worry is millions could lose coverage. They also strongly reaffirm the push for parity.
Meaning mental health care should be covered the same as physical health care, not like some optional extra.
Precisely. It's been a long fight, and it's still critical.
But even if you have coverage, finding someone.
That's the next barrier. The source emphasizes improving the accuracy of provider directories and ensuring network adequacy.
Meaning there are actually enough providers in your network that you can realistically see someone.
Right. It's incredibly frustrating otherwise. You have the card, but no one takes it or has an opening for months.
Yeah.
They also support using innovation, like telehealth and digital health tech, but, and this is key, focusing on making sure they're effective and that the payment structures support what the patient actually needs, not just what the payer prefers.
So tailoring treatment to the individual.
Yes. And a huge piece of access is building a well-trained workforce. Shortages are acute, especially for kids and young people.
And does this priority touch on crisis response too?
It does. They advocate for shifting away from relying on law enforcement
Which often isn't the right fit.
towards non-coercive, person-centered options, things like peer respites, those short-term peer-run crisis stays, and mobile crisis teams that can actually meet people where they are.
Offering more compassionate alternatives in a crisis moment.
Exactly. They list bills supporting telehealth access, expanding who can get paid for services, like the Real Health Providers Act, and generally improving the system. Plus, pushing for more funding for 988, the crisis lifeline, and protecting Medicaid funding.
So access means getting in the door, getting the right care, and having support when things are most critical.
That covers it well.
Okay, the fourth and final priority, ensuring equity and reducing disparities.
Yeah, this acknowledges a crucial point. These challenges we're talking about, they don't hit everyone equally.
Right.
Certain communities based on race, geography, income, identity face much bigger barriers and often have worse outcomes.
So what are the strategies here?
One big one they advocate for is integrated care, bringing mental health and substance use care into places people already go.
Like schools and primary care clinics.
Exactly, meeting people where they are. This can really reduce disparities by making care more accessible and, importantly, less stigmatizing.
Makes sense.
They also support expanding and diversifying the workforce itself, including providers like doulas, peer specialists, community health workers, people often from the communities they serve, trained in cultural humility.
Cultural humility. Meaning understanding you don't know everything about another culture, but approaching it with respect and a willingness to learn.
That's the idea. The goal is to fight disparities across the board. Access, data collection, addressing those social drivers we mentioned, and research. They even collaborate with other sectors, housing, child welfare, to tackle specific disparities, like in maternal mental health.
And are there specific bills for this too?
Yep. The source mentions supporting things like the Complete Act and the Pursuing Equity in Mental Health Act, which specifically target these equity issues.
Okay, so these four priorities, lived experience, prevention, access, and equity, they really map out the policy agenda for many advocates for the next couple of years, the systemic changes they're pushing for.
That's a good summary. It's the big picture policy push.
All right, so those are the big goals the policy asks, but what does it actually feel like for people trying to use the system? We have another source that asks some really practical questions, probing the on-the-ground reality. And these questions, they seem to tie directly into the details we find in that source, specifically focused on rural mental health.
They do. It's like the questions frame the practical challenges, and the rural data gives us the stark evidence of where the system is often falling short. These feel like the real-world hurdles that make those policy goals so necessary.
Let's dig into that. Starting with access barriers and the workforce. The questions ask, well, what are the biggest barriers, especially in rural areas? And, how can we expand that workforce?
Well, the rural mental health source, it spells this out pretty vividly. Beyond the obvious stuff like long travel distances or insurance hassles,
Right.
it points to providers sometimes not fully recognizing or understanding mental illness and just a massive chronic workforce shortage.
And the numbers comparing rural versus urban workforce density in that
Yeah.
source are, Well, they're kind of staggering.
They really highlight the scale of the problem. Think about this. For every 100,000 people, rural areas have significantly fewer mental health pros across the board.
Like how much fewer?
Okay, so for counselors, it's roughly 88 in rural areas compared to 131 in urban. For psychologists, it's 16 versus 40. But look at psychiatrists.
Huh.
It's stark. 3.5 per 100,000 in rural areas compared to 13 in urban.
Wow, that's not just a gap, it's a chasm. Nearly 4 times lower density for psychiatrists.
It really puts into perspective the challenge of simply finding someone. The source notes that as of early 2024, there were almost 4,000 rural areas designated as mental health professional shortage areas, HPSAs.
HPSAs.
And it would take over 1,600 practitioners just to get rid of those shortage designations. So the question's asking how to expand the workforce. The rural source points to things like using more telemental health, loan repayment programs to incentivize practice there, creating rural clinical rotations for students.
Okay, that leads right into the next challenge area, virtual behavioral health, or telehealth. How much does it really help with access, and what are the limitations versus seeing someone in person?
The rural source definitely highlights telehealth. It saw a big increase during the pandemic, obviously, and it was vital for many rural residents to keep getting treatment. The convenience, cutting out travel time, is huge.
You need good internet, right?
Yeah.
Which isn't always a given, especially rural.
Exactly. That's a major challenge. Lack of broadband access makes video telehealth impossible for some.
So it's not a magic bullet.
No. But there are regulatory changes helping. Like Medicare now permanently allows audio-only mental health and substance use services for rural folks in certain situations. So telehealth is crucial, it helps, but infrastructure is still a big hurdle.
Got it. Another practical challenge from the questions. Mental health in primary care. How has separating behavioral health from primary care maybe made the crisis worse? And what would it take to integrate them?
Yeah, the sources strongly suggest this separation has contributed. Most people, when they feel something's off, even mentally, they go to their primary care doctor first.
Makes sense. It's familiar.
Right. So having mental health services in a totally separate system adds significant barriers. Another referral, another clinic, another appointment to make.
Or hoops to jump through.
Exactly. And the rural source really champions the benefits of integration, like co-locating mental health providers within primary care clinics, especially in rural areas.
Why especially there?
Well, where providers are already scarce, integration maximizes those limited resources. It increases access because patients are already there. It improves quality through better coordination between physical and mental health care. And, significantly, it helps reduce stigma. And those fears about anonymity that can be really strong in small, close-knit towns, seeing a therapist in your regular doctor's office can feel a lot less exposing.
That makes a lot of sense. But are primary care docs equipped to handle everything?
The sources suggest they play a vital role in, initial identification and basic care, but integration is really about bringing in the mental health specialists to work with them as a team.
So it's team-based care.
Exactly. The rural source also points to school-based health centers as another good integrated model, especially for reaching youth.
Right. Which brings us to the last challenge area here, understanding mental health and stigma. What are the common myths, and how can communities actually shift attitudes?
The rural source tackles this head-on. It notes that misconceptions, myths, stigma, they're huge barriers, often stemming from lack of understanding, fear, and, those confidentiality concerns in small towns.
And that impacts whether people even seek help.
Absolutely. And how they're treated if they do. It creates secrecy, isolation.
It sounds like the very closeness of small towns can be like a double-edged sword. Supportive, maybe, but also hard to have privacy.
That's a good way to put it. While stigma can be intense, the potential for strong community support is also there. The sources suggest programs like mental health first aid can be powerful.
That's the training for community members.
Yeah, training people how to identify, understand, and respond to signs of mental health challenges. It helps increase understanding and chip away at that stigma. Changing the status quo requires active effort education, normalizing conversations from schools, faith leaders, local groups.
It's not just awareness, it's action.
Precisely.
Okay, this all connects to a really difficult but absolutely crucial topic highlighted across these sources, suicide.
Yeah. Suicide is described flat out as a major public health concern in the rural health source. And the broader NIMH stats remind us that while millions have mental illness, only about half get treatment. That's part of the backdrop.
And 988 is there for crisis.
Absolutely, a critical resource.
But the rural source, It has some really tough data on suicide rates there.
It does. It shows a worrying trend. Suicide rates have consistently been higher in rural counties than urban ones. And concerningly, that gap has widened significantly over time.
How much higher?
From 2000 to 2018, the rural suicide rate jumped by nearly 50%, compared to 34% in urban areas. By 2018, the rate was 19.4 deaths per 100,000 in rural areas versus 13.4 in urban.
That disparity is stark. And does it affect all groups?
The data shows it holds true across age and sex groups. That specific table for 2013-2015 confirms higher non-metropolitan rates across the board.
Any sense of why?
The source mentions possible factors: limited mental health access, social isolation, the impact of the opioid epidemic, economic stress, a mix of things.
And those questions we looked at earlier also pointed to systemic gaps in crisis response, right? Like, the help isn't always there when someone is in crisis beyond just the ER.
Exactly. That systemic gap is key, and the sources emphasize how communities and schools can take action for prevention, but also for support before and after a crisis.
What kind of actions?
The rural source details strategies from places like the Suicide Prevention Resource Center, SPRC, toolkits for primary care, rural-specific prevention efforts, and crucially, school-based programs.
What kind of things are schools doing, or could they be doing?
The source lists things like gatekeeper training for staff, helping them spot students at risk, mental health screening, health education that includes suicide prevention, peer mentoring, providing actual mental health services on campus, crisis response planning, and postvention toolkits.
Postvention for after suicide.
Yeah, resources to help a school community cope and heal after a loss. And that question about when prevention should start. It hits hard when you see suicide as the second leading cause of death for kids 10-14 and third for 15-24, according to that rural source.
Wow, second for 10-14-year-olds. That really underscores that prevention needs to start early.
Painfully early.
This strong focus on youth and the urgency there leads us right into the final area we wanted to explore, the youth mental health crisis specifically, and a concrete initiative trying to address it.
Yeah, the youth mental health crisis is a huge concern across these sources. From the MHA policy priorities pushing youth-specific bills to the Surgeon General's 2021 advisory that really sounded the alarm nationally, the stats are just alarming.
Yeah, that source focused on youth initiatives had some tough numbers.
It notes a distressing 62% increase in suicide rates for youth aged 10-24 over just 15 years.
62%.
Yeah. It mentions up to 95% of teens use social media, tying back to that prevention priority about toxic digital environments. And this one is striking. 1 in 3 high school students and half of female high school students report persistent feelings of hopelessness.
Half of female students. Those numbers they're really hard to hear, impossible to ignore.
They really underscore the depth of the crisis, but the source also presents a tangible example of how people are trying to respond.
Yeah.
The Youth Mental Health Corps.
Okay, tell us about that. What is it?
So, the Youth Mental Health Corps, it's described as this collaborative initiative. It's designed to tackle 2 things at once. Actually support youth mental health now and also provide accessible pathways into behavioral health careers for young adults.
Interesting. So support and workforce building.
Exactly. And it seems to be scaling up fast. Launched in 4 states in 2024, planning to expand to 7 more in 2025, with another 6 states in planning.
And it uses this idea of near-peer support.
It does. The source highlights examples like in Minnesota, where young adults are trained to support other young people. The thinking is, having someone closer to your own age who might get what you're going through, it can make getting help feel less intimidating, more relatable.
Yeah, I could see that.
The Youth Mental Health Corps sort of formalizes this. It offers structured career pathways for young adults.
What kind of pathways? What roles?
The source details 3 main certification pathways: becoming a school-based mental health navigator helping students connect with resources, a peer support recovery specialist, this one specifically requires lived experience and it's open up to age 29, and a community health worker.
And these roles provide training and lead to credentials.
Right. They provide essential training, practical experience, and clear steps towards certification or credentials. So it's creating this pipeline of young professionals who are passionate about helping their peers and communities.
So it's not just about getting help to kids now, but actively building the future workforce, recruiting young people, including those with lived experience, into the field.
It's a really innovative approach, connecting that urgent need for support with actual career opportunities, empowering the next generation to be part of the solution, leveraging that unique near-peer perspective.
Okay, so Let's try and pull this all together. We've looked at policy priorities, the practical challenges, specific issues like rural access and suicide, and this focus on youth and initiatives like the Youth Mental Health Corps. What does it all mean when you step back?
Well, these sources, taken together, they paint a pretty clear and, frankly, urgent picture. The U.S. is facing significant mental health challenges, big hurdles in access, especially stark in rural areas with those extreme workforce shortages,
Right.
a system that hasn't always integrated care well or effectively tackled stigma, and a growing crisis among specific groups, most visibly our young people.
And the policy goals show where advocates think the system needs to go.
While the challenges really highlight the, stubborn realities on the ground that make that progress so hard, but also so essential.
And it feels like while the scale of the problem is huge, there are concrete strategies and initiatives happening.
Absolutely. Things like pushing for integrated care, using telehealth where it works, community-based prevention efforts, really prioritizing lived experience as a form of expertise, and programs like the Youth Mental Health Corps. They offer tangible pathways forward.
But it's not just about having these options, is it?
No, the sources make it clear that just knowing the facts or having programs isn't enough. There's significant work still needed to overcome those practical barriers, dismantle stigma, really shift our cultural understanding so that awareness turns into actual, tangible support that reaches everyone who needs it where they are.
And the importance of community action really comes through, addressing social drivers, supporting peer networks.
Undeniable.
Okay, so thinking about all of the challenges of access, affordability, availability, acceptability, especially in underserved areas, and this call for community involvement and shifting understanding. Here's a final thought for you, our listener. What specific step could you explore, maybe in your own community, your sphere of influence, to help turn this awareness into tangible support for mental health?
That's a powerful question to sit with.
Thank you for joining us for this deep dive.